First of all, welcome to our poster presentation. Our study is titled Characterization of the Effects of Body Habitus on Apixaban Levels in Patients with a BMI greater than or equal to 40 or a weight greater than or equal to 120 kilograms. The goal of this study was to explore a recent statement from the International Society on Thrombosis and Hemostasis giving caution to providers in prescribing DOACs to patients with a BMI greater than or equal to 40 due to uncertainty and lack of representation of this population in the literature. This is of specific importance as many patients were affected by this recommendation, being offered only warfarin for anticoagulation or being switched from their current anticoagulation to warfarin for long-term anticoagulation. We decided to evaluate Apixaban specifically as it's the most widely prescribed direct oral anticoagulant and has a readily available Apixaban both peak and trough level that can be performed through the Mayo Clinic. During the duration of our trial, we were able to enroll and screen 44 patients, which was unfortunately cut short due to the COVID-19 outbreak. Our results displayed a largely therapeutic Apixaban serum peak and trough level in this patient population, and interestingly, we did not see any specific trend in the analysis of BMI with peak or trough serum levels of Apixaban. However, we did find a notable 1.5 nanogram per mil decrease in the peak serum levels of Apixaban and a 1.1 nanogram per mil decrease in the trough levels of Apixaban per kilogram weight increase in our patient population, which was adjusted for both gender and creatinine clearance. In conclusion, our study found that in most patients, regardless of their presenting BMI, Apixaban was therapeutic at the recommended dosing for the general population, and we did not find that there was any specific group of patients in a specific BMI that should be excluded from using Apixaban. However, we did find that there was a corresponding downward trend in peak serum levels and trough serum levels per increase in kilogram overall weight for our patient population. Though a larger study would of course be helpful to clarify at what weight a patient should order peak and trough serum level screening for patients taking Apixaban, our study did display that for most patients, therapeutic levels of Apixaban for anticoagulation can be achieved regardless of their BMI or their weight, and that concerned patients or providers can be more reassured with monitoring peak and trough serum levels on occasion through the Mayo Clinic's testing. And this would help with long-term shared decision-making for anticoagulation in patients who would prefer to stay on their direct oral anticoagulant. We hope you found this poster helpful in your everyday practice and found it interesting. Thank you for attending.